to do the jumping up and down, but come on. Let's get some energy up. Act as if you're a champion. Turn to your neighbor and say, born a champion! Born a champion! Too fast for you, JoJo. You missed all the action. Welcome, welcome. All right, you guys ready to have some fun tonight? Yeah. Awesome. Well, for those of you who guessed, I'm Dr. Yachter. For those of you who aren't, thank you for being here. And how many of you guys, this is your first workshop you've ever been to? 1, 2, 3. Give them a big round of applause. Good. And how many of you guys have been to a workshop before? Pretty much everybody? Keep your hands up. You've been to 3 or more workshops. 4 or more, 5 or more, 10 or more, 20, 30, 50, 70, 90. Okay. We always have like the 90, 100 plus club, a few here and there. So we've been doing the workshops for a while. And you'll see as the night goes on, you're going to learn something. How many of you guys like learning? Oh, yeah. Yes. When you stop learning, you stop growing. And when you stop growing, you start dying. So this is about constant and never-ending improvement. And if you're a champion, that's how you think. All right? You don't wait for it to happen, you make it happen. Yeah, so you guys are here to make it happen tonight, and we're gonna make a lot happen, that's for sure, yeah. All right, so next month, our workshop is diabetes and blood sugar control. This is a major issue, whether you're diabetic or not. If you want to learn how to get your blood sugar under control, your weight under control, you know, if you've got high blood sugar, you're pre-diabetic, or you have diabetes, you're increasing your risk of cancer, heart attacks. Basically it causes early death. So this is a workshop that really everybody should be at. And if you've got loved ones, family members, friends who need to lose weight, who need to get their blood sugar under control, this workshop's a gift. I mean, the information is just so profound. And it's just so obvious. And when people come here, they're really blown away with that. So I'd encourage you to put that on your calendar. If you don't have one of those workshop cards, you should have one because it'll tell you what the titles are for every month. And the beat goes on. Okay, so let's make this applicable to each and every one of you here. The person on your left, the person on your right, you and me. We're all in this thing together. How many of you know somebody who's ever had a run-in with cancer? Everybody. Why is that? Because 1 out of 2 men are diagnosed with cancer. 1 out of 3 women are diagnosed with cancer. Breast cancer, lung cancer, colorectal cancer, prostate cancer, pancreatic cancer. You've heard it all, right? Our mindset tonight really should be, you know, yeah, we want to prevent it, but really, our mindset really needs to be like, you know, my body makes cancer cells. Everybody's making cancer cells. So really the mindset should be like, you know, it's gonna happen. At some point, if you're playing the medical game, if you're going to doctors, and I don't tell you not to go to doctors, so I would say the majority of you here, every year, you're going in for your checkup, you're relying on medical feedback, you're putting yourself out there for medical testing just to be sure, right? And you're going to get feedback on this, and at some point you're going to get a report that is probably not to your liking, right? Would everybody agree? There's a high probability of that. So the question becomes, how do you respond? Not react, right? Because you don't need me for that. Everybody reacts. And they react in fear, and then you make decisions, and you wind up with bigger problems than if you started with and you did nothing. You know what I'm talking about, right? So the question becomes, again, how do you respond? Well, first and foremost, you gather information. Most importantly, you learn how to think differently. You know, because I can tell you what to do, but if you don't understand that conceptually, if you can't think from a higher aerial view, a 30,000 foot view, and you don't see the big picture, chances are you're not going to make the decisions that correlate with that. Is that kind of making sense? So, in 1940, we had 1 out of 16 people diagnosed with cancer. In the 1970s, it was 1 out of 10, and today it's 1 out of 3. So today, what are we looking at? We're looking at 5 times more cancer, a little more than that, 5 times more cancer today than we've had ever. Every 30 seconds, someone's diagnosed with cancer. Does that make sense that today we have 5 times more cancer than the 1940s? We're raising more money. We have the pink ribbons, we have fundraisers, we have more research being done, we have more money being spent on cures for cancer, but yet we have 5 times more cancer. President Nixon declared war on cancer, but yet it still keeps getting worse and worse and worse. Why is that? Has the human DNA changed all that much since 1940? Have we evolved negatively as a species since 1940? Like what is happening here? Well, I've been talking about this for years now, how all the studies outside the contemporary medical model are talking about this thing called epigenetics. It used to be that your family, if your family had cancer, how many of you guys have had family members that have had cancer, or diabetes, or heart disease? Every time you go to a doctor, they make you check your family health history, right? Because if it runs in your family, woo, look out. So that's got us running for cover. And in the reality, what is all the new research showing is that that's only 5 to 10% of whether or not you're going to get cancer or you're going to get heart disease or any of that. What really the 90 to 95% is the epigenetics. How many of you guys know what epigenetics is? Have you heard of that before? Yeah. Epigenetics is the environment that you're exposing your DNA to. And basically, what you're doing to influence those genes to promote cancer or fight it. You're either going to promote cancer or you're going to fight it. And it's the environment that you subject your DNA to which is going to determine 90 to 95% of the time whether or not you're going to get a cancer diagnosis. Whether or not you're ever going to have that conversation with your doctor as far as whether you get the biopsy, whether you need chemotherapy or radiation, right? It's whether or not we address all these things. So what accounts for this 90 to 95%? Does alcohol increase your risk of cancer? Yes. Being overweight increase your risk of cancer? Yeah. If you're toxic? Yes. Sedentary, meaning no exercise? That all increases your risk of cancer. Subluxation, if you guys know what that is, nerve interference, that increases your risk of cancer. Sugar, stress, tobacco, so you get the picture, right? So what that means is that if you address these lifestyle issues, what you can actually do is you can shut off the cancer-promoting genes and turn on the cancer-fighting genes. Is this making sense? Say yes? Yes. Okay. So you're basically going to be flipping the switch for better or worse. And the people who don't understand this concept, who go through life, who just leave it to chance, or just completely react, or they choose to not do anything except go for mammograms or prostate exams or tests and wait for the diagnosis, that's too late. The genes have already expressed themselves. The cancer's already there. The diagnosis. Once the diagnosis is there, it's too late. What we're talking about is preventing it. Right or right? Right. So your cancer-promoting genes can be turned on, or cancer-promoting genes can be turned off. Cancer-fighting genes can be turned on, or cancer-fighting genes can be turned off. It all has to do with how you flip that switch one way or the other. And that's what I want to talk to you about tonight, understanding that conceptually. I don't want to get ahead of myself, but number one, how do we turn off the cancer-promoting genes? That's the question. How do we turn off the cancer-promoting genes? Eliminate cancer-promoting drugs and testing. What are you talking about? Well, we are born into a medicine chest. We are, in this country, other than New Zealand, it's New Zealand and the United States. In no other country in the world do people react like when they have a pain, ache, symptom, and they go to take a pill. Like, they don't do that in other countries. The only nonsense is right here. Like, we have a pill for every ill because we've been brainwashed to do that. So what do people take Zantac for? Heartburn. Would you be taking that for heartburn if you knew you were increasing your risk of cancer? Heck no. How long has Zantac been on the market for? Too darn long, right? So what's happened now? It was just pulled. Zantac was just pulled from CVS just a few weeks ago. How many of you guys saw this in the news? Because it contained a cancer-causing impurity. And now Walgreens just pulled it. Maybe you guys, saw this not too long ago. I think this was earlier this year. They said, don't take an aspirin a day to prevent a heart attack and stroke. How many of you guys heard that you take an aspirin a day to keep the doctor away? Yeah. Oh, just take your baby aspirin. Some doctors actually still tell patients to do that. Take your baby aspirin. Take an aspirin a day. It prevents heart disease. In the news now, they're saying that was a bad idea. But they're saying now it doesn't really reduce heart disease. They've never seen in a long-term outcome study where they actually saw the results of that. So where did they get that from? Who promoted Zantac and an aspirin a day? The pharmaceutical companies who are teaching the doctors for the continuing education, and then the pharmaceutical reps who march into their office and say, hey, you move enough of this, you're getting a free trip to Hawaii, right? Free set of golf clubs. And that's why we do what we do. And then we get what we get. So women take an aspirin a day for 5 years or more increase the risk of breast cancer by what? 80%. So for years they've been telling you to take one a day to prevent one disease, and what is it causing? You're turning on the cancer-promoting genes by listening to the drug commercials. That's what we've been doing. We've been doing it to ourselves because we're outsourcing our common sense and our responsibility for our health. And this is part of the recipe for getting cancer, guys. This is a big part of it. Cholesterol drugs. And I don't want to hit on a nerve, no pun intended, but we talked about this at the last workshop. There is no evidence that cholesterol-lowering drugs will reduce your risk of a heart attack. And there's every bit of evidence to show that lowering your cholesterol will literally double your risk of cancer. And not only that, but cause other health issues. But yet people continue to take cholesterol drugs because their doctors recommend it. And perhaps some of you are sitting in the room and you still are afraid to let that go because you don't want to confront your doctor with the medical evidence from the journals that they read from that I showed at the last workshop. If you weren't here, go on YouTube and watch it. And if you don't like what you hear, you can do something about it. Because you know what medical doctors don't like? You know what your good-hearted medical doctors don't like? When smart people ask them intelligent questions. Because when you do that, and you have evidence from their medical journals to back up your intelligent questions, you know what they say? Okay. And they let you get off of it. Yeah. How many of you guys have seen that? When you came out of a workshop, you used the stuff that we gave you, you went back and gave it to them, what'd they say? Yeah, I guess okay. And what'd you do? You saved your life, probably, because if you wouldn't have done that and stayed on it for another 10 years, you would have lost years off your life and increased your risk of cancer. So don't be afraid to be bold. I want to be of an encouraging spirit now so that you guys don't walk in fear. For lack of knowledge, people perish. That's why it's so important to keep coming back to these workshops. The more you get from this, the more you get the bigger picture. And you're like, okay, I'm not going to do this, I'm not going to do this, I'm not going to do this. And when that time comes, you'll be ready. You'll be ready, because I'm not speaking this over you, but this is kind of what I see. Like, everybody goes to the doctor, and then at some point, somebody gets a bad report. Are you going to wig out, or are you going to tap into the gems and the resources that we're talking about right now, right? Because God has not given you a spirit of fear. You know that. Antibiotics, and again, this is just a reaction of what your parents did for you, what my parents did for me. You get a cough, sniffle, sneeze, flu, and automatically you think that if you don't get an antibiotic, you're being irresponsible and you could actually die. It's not, there's no founded evidence on that, guys. And I'm telling you how I've done this, lived my life, I guess since I left home 40 some odd years ago, but I also raised a family. I have a 20-year-old, a 15-year-old, a 12-year-old. They've never had any antibiotics. They've never had a drug in their body, and neither has my wife since she's been married to me. Not because I put a gun to anybody's head, but because we do things different. We know that when you have a cough, sniffle, sneeze, or flu, or an infection, it's not because of a lack of antibiotics. When you have a headache, it's not because of a lack of anisine or aspirin. It's like God doesn't make junk. There's not a lack of anything. And the Lord knows, we all know that The healing doesn't come from outside in the form of a pill, potion, and a lotion. It comes from where? Inside. Right, Ingrid? If you look at Ingrid's shirt, it says, for a cure, looking for a cure or something like that. I was looking at it before. I love her shirt. It's just, and on there it says, in search for a cure, search for a cure. And what did we say? There's only one cure. One cure. And if there's only one cure, there's one cause. And the cure is the body always heals from the inside out. So there can only be one cause of that. When there's an interference to the intelligence that coordinates that healing and function from the inside. And if you remove that interference, there's your cure, not from the outside in. And as we go through this, you're seeing that. There's the evidence of it, right? This is all part of the recipe of the lies that we bought into living in this country, in this society. Blood pressure medications. Last one, I talked about this also. How many blood pressure medications were recalled last year for cancer-causing impurity? 4 of them. Losartan, valsartan, irbesartan. And you know, the sad thing is I have a few patients that their doctors still have them on this stuff. So we have to ask ourselves, you know, is there a better way? What else can we do? You know, and again, I'm not telling you that there's not an appropriate time or place for medication or surgery or medical doctors. There is. But the more proactive you are and the more educated that you get and the more that you put these things into play, the more you're reducing your risk of ever winding up in that situation. And let me tell you guys, for those of you who are under chiropractic care, I think the biggest thing that we all forget is that you're not like the rest of the population out there. People under long-term chiropractic care, there's a huge gap in the likelihood that somebody like yourself gets, you know, an unexpected heart attack, an unexpected bout of cancer, a diagnosis like that. Very, very, very unlikely. Least of which is that you die unexpectedly, or you get a bad prognosis if you do get diagnosed with cancer. And I can tell you that I have chiropractic patients that have been with me for years, and they're really nervous. You know, if something like that happens, and I'm like, no. This, you don't understand that if you were not under chiropractic care, yes, I'd be worried about that. But you got all these years of chiropractic care that's made your body so much stronger in its ability to rebound and heal up fully, completely, right? So don't ever forget that. You know, every adjustment that you get is like money in the bank, and you never know when you're going to have to withdraw, and you're going to have a big cushion there. Does that kind of make sense? Yeah. Your health is your wealth. Yeah, it's your health bank account. At some point, you know, we all have to take a loan, so to speak. We all got to dip into the kitty. And with every adjustment you get, you're building that sucker up. And you're way different than most other people out there that are not getting adjusted. Those are people, a lot of times, that are living on a wing and a prayer. They don't have an alternative but to go to doctor and get medications. Different for you guys. You're putting your confidence, your faith, your belief, and your actions in a different place here. So what about mammography? You know, are you supposed to get a mammogram or don't get a mammogram? What happens when you get a mammogram? By the way, when they do a mammogram, does anybody know what goes on when they do the mammogram? Are there side effects? Are there considerations with a mammogram? Yeah, and so there's radiation, significant amount of radiation. What does radiation do to your risk of cancer? Increases it. And what about the pressure that's put on the breast? Yeah, I mean, if there are cancerous cells, you're increasing the risk of rupturing them and spreading them. And what if they do find something? They call a false positive. They call you back for more. What do they want to do? A biopsy. What has science shown that biopsies actually cause to tumorous cells that your body probably would have cured anyway and reversed it? What does it cause those cells to do? To spread. So we've heard some of this before, but it never fails to blow our mind, right? And every time you see a pink ribbon, everywhere you see that, I just passed the trailer on the highway coming home last night. What are they telling people to do? To get mammographies. And yet, the longest study that was ever done, 90,000 people, 90,000 women did a study over the course of 25 years. And what do you think the results of that study show? Did mammography save lives? Okay, so I want you to listen to this. This comes from a medical doctor, an expert on
This study shows us that the benefits of mammography are less than we had hoped for, and the potential harms are greater than we had anticipated.
February 2014, one of the largest ever studies of mammograms indicates that they do not reduce risks of cancer deaths. Dr. Joanne Elmore.
This study reported that a large population of women that are randomized to get screening mammography and a good breast exam versus those that don't get the screening mammography, that there's no difference whatsoever in subsequent mortality.
Does this study give you pause about recommending mammography?
This study adds to an accumulation of data. Over the last 5 years, we have been seeing more data from multiple large studies showing at a population level that we're not seeing the benefit from mammography that we had hoped. The more you look, the more you find with screening mammograms, and we are unfortunately potentially detecting a lot of tumors that the women would have lived with for their entire lives and it would have never harmed them.
Wow.
And this is called overdiagnosis.
Huh.
This is a screening test, and so they see abnormalities and they ask the women to come back. In other words, they'll send a letter or they'll call the woman to say, "Dear Mrs. Smith, don't worry, but an abnormality was noted. It might be cancer. We need you to come back for additional testing." The great majority of those episodes don't end up diagnosing cancer, and so we call those false positives.
So false positive happens more than 50% of the time. And then what happens after the false positive? There's recommended treatments, there's biopsies, there's possible mastectomies, all the things that she talked about. And what is increasing the traffic to the mammographies? All that we talked about before, the race for the cure. Now, I'm not against anything that's for humanitarian purposes to help people. But the question is, I always ask, my patients and the people in the audience, is like, do you even know where that money's going? How many of you guys know who started the Pink Ribbons? Who started the Susan B. Komen? And she was a front runner for really who supported her backstage, which is AstraZeneca, which in 1985 they formed that as a nonprofit organization so that they could push what? They had the drugs, tamoxifen, Arimidex. So they had the drugs, and they just wanted to get more use out of it. So how do you get more use out of a drug? By getting people screened, increasing awareness of mammograms and breast cancer. So do you think they sold more drugs? Sure. And they did it under the guise of fundraising and something that seemed humanitarian. Now, along the way, corporate America saw a great opportunity for marketing their own businesses. Now they pay licensing fees, and there's billions of dollars that have been raised for cancer cures. But where's all that money going to? Looking at creating new drugs to treat the effect instead of correcting the cause or preventative programs. So what do we have now? We have every drug that comes out may kill the cancer, but it also kills the patient in the process. And so you have leukemia, liver, uterine, gastrointestinal cancers as one of the main side effects from tamoxifen. So it really is sad when you pull the curtain back and you look at really what's happening. It's all about marketing, corporate America. Everybody's making money on this stuff, and they're raising money, and very few people really ask questions or maybe don't even care where the money goes. And this is what's happening. Does the money go for education or prevention? Yeah. Is this part of the solution or is it part of the problem? Yeah, it's part of the problem. I hate to say it, it's part of the problem. It's causing more people to be exposed to this unnecessarily, whereas the medical doctor said it herself, that most of these tumors, if they were left alone, what would happen? The body would what? Heal itself. Oh, what a novel concept. The body heals itself. I've never heard of that before. Have you ever heard of that before? Well, if you've been in this office, you have. But there's a medical doctor saying it right there because she's probably sick and tired of people being lied to and drugged to death and butchered. She did not look happy. And I would hate to be in that position. You spend 12 years going to school, climbing the ladder to success as a physician, to get to the top and find out your ladder's at the wrong building. It's horrible, horrible. Half my family are medical doctors, and I don't regret one day for choosing the profession that I did. because it's the truth, and we work with principles. And the principles that we're talking about will never change. So first and foremost, know what not to do that's causing cancer. This is part of it right here. PSA screenings, no different for guys, right? When you go in and they put the rubber glove on, you know what you're in for, right? It's like the worst nightmare. I've never had it done, but I couldn't even fathom that. I'm cringing at the thought of that. But what you're gonna hear right now is from Mayo Clinic doctors that are coming out on record saying completely unfounded. There's no evidence. And there's really no reason to do a prostate exam on somebody who has no symptoms. And you know what PSA is, right? Okay, so
PSA, which stands for prostate-specific antigen, which is a protein that's actually secreted into the blood system by the prostate, and it can be abnormally elevated for numerous reasons.
Director of Research at Mayo Clinic's Department of Urology, Dr. Jeff Carnes says such false alarms may subject men to unnecessary tissue sample biopsies or to aggressive cancer therapies that may not be warranted. Recent well-designed studies in both the U.S. and Europe have concluded PSA testing shows very little benefit for men with no symptoms of prostate cancer. Dr. John Tilbert says that may seem surprising.
But that's the general feeling right now, is that screening in the general population probably doesn't save a whole lot of lives based on what we can tell right now.
Using the same logic, Dr. Tilbert says some doctors are beginning to rethink the value of the dreaded rubber glove exam, in which doctors try to feel for bumps or tumors in the prostate.
There's a very limited role for the snapping of the glove in the asymptomatic man, in my
opinion. And there you have it, guys. So we've talked about this before. You know, my dad went for his exam last year, and his PSA was 30. Ooh, that's right. You know that's not good. Where's like a normal PSA? Under 3, like 1, 2, or under 1. So his was 30. So what do you think happened from there? Oh, the alarms went off, the bells and whistles. So, you know, my dad doesn't want invasive things like biopsies, and he flat out told the doctor, he's like, listen, he's like, I don't have any problems. I'm urinating fine. I don't have any pain. And the doctor did the exam, and he's like, well, I don't feel anything abnormally large in there. So my dad's like, well, listen, he's like, I'm not doing anything. I'm not going to get a biopsy. If you don't feel anything, I don't care what that number says, because PSA is a prostatic specific antigen can also be elevated by inflammation. It can be elevated by infections. And so after we were talking, I figured out where it was coming from. He's out there riding his bike for 30 minutes every single day. And my dad, when he gets on the bike, he goes, you know, 10/10ths, like he goes all out. And we finally figured out that that's what was causing it. Since then, his PSA has come down. But again, if he didn't know this, if he would have acted in fear, then what would have happened? They would have stuck a needle in him, and it probably would have went from bad to worse. Even though it would not have been inflamed, what's the likelihood that they would have found abnormal cells in there? Highly likely. And he probably wouldn't have had any problems with his prostate, and they would have done more tests, more studies. And think of the anxiety and the problems that people go through when they go through these testings. And at the end of the day, what did you hear that all these medical doctors say for the mammographies and the prostate exam? What did they say? No evidence. No evidence. There's no reason to do it at all. And again, especially if you're under chiropractic. Now, if you decide to do it, I don't love you any less. Don't think I'm going to pass judgment on you. But my whole point of discussing this with you is so you understand what you're getting into. If you want to walk in the lion's den, just be ready to fight. That's all. Don't lay down like a lamb. Just be ready to fight, because it's your life, and nobody's going to fight for your life except who? You, yeah. You're getting the truth from other medical doctors. Listen clearly, loud and clear, because the writing's on the wall. And if you go to a medical doctor that doesn't know what you're looking at right now, then you have to take control. And if you don't like what your doctor's talking about, then sometimes you got to get a second and third opinion. Journal of the American Medical Association. I think this is probably the most prestigious medical journal in the world. They said that our technologies have gotten so good that we can find some early cancers or things that look like cancer that if what? Left alone, would never grow, spread, and harm the patient if they were left alone. okay? Now, if you have symptoms or you feel a mass and it's getting bigger, hello, that may be a time to listen. But what you're hearing so far up to this point is that if it ain't broke, what? Don't go fixing. If you don't like trouble, don't go looking for it, right? That's the name of the game. That's the tune that you're hearing. But if there's something obvious that you're seeing and it's not normal, yeah, get it checked out. But when you get it checked out and you get a diagnosis and they do say it's cancerous and they do say that something needs to be done, then the question goes to, how do you handle it? Do you proceed with the conventional medical recommendations, which are going to be what? Chemotherapy, radiation, different forms of shots and medication. They all serve a purpose, but they all come with, consequences also. So it's good to know how everything works, and this is what I'm going to go through right now. First of all, radiation and chemotherapy treatments, UCLA Comprehensive Cancer Center said this: radiation can transform benign breast cancer cells into what? Highly malignant cells. All right, so oftentimes what happens is they'll go in with somebody with breast cancer and they'll do radiation, and they'll affect or shrink or kill some of the cancer cells that they've identified need to. But then there are benign cells, and you wake up a sleeping giant in those cases. And that's why you see in many cases where people have cancer and they get chemoradiation, what happens? It comes back. In other cases with chemotherapy, I played a video of Dr. Russell Blaylock, a medical physician, who in his interview said, and this is true, that if the problem with chemotherapy is it doesn't kill the cancer stem cells, it'll kill the cells around it. And you can shrink that and you can kill the cancer cells, but if you don't kill the stem cells of the cancer cells, what happens? They come back infinitely more aggressive. And this is where we don't get either told the whole story, or the doctors don't have any other alternatives, so the chemo or the radiation is going to be their best recommendation. And you're left with very little that you can decide as far as how to move forward with. You're not given very many options. But again, in some cases, something has to be done to shrink the tumor, especially if it gets to the point where it's disfiguring, right? Or maybe it gets to the size where it's obstructing organs. Something has to be done. But understand what's happening at a cellular level, okay? Now when you grow a cancer tumor or a cancer cell, if it proliferates and it gets large and out of control, why is it in that one spot in your body and nowhere else? Does anybody know the answer to that? When you have cancer that metastasizes through your body, if it has the opportunity to go rampant and literally spread through your body, why does that happen? Is your body strong or is it weak when that happens? It's weak. And when did that cancer start, in its infancy? Like a few days or a few weeks ago, or what? Years. Yeah, by the time they identify it, it's already been there in most cases a good decade, sometimes even two. So what happens is at a cellular level, the tissues are already weak. Your body is already sick. Your body's sick for a long time before cancer has an opportunity to develop and get to the size where it's diagnosable. So you don't get cancer and that's what makes you sick. You get sick, and because of that, you get cancer. Yeah. Cancer needs a ripe host to develop it. So does bacteria, and so do viruses. So you have viruses inside of you and bacteria inside of you right now that normally wouldn't cause a problem. But when your resistance goes down, what happens? They're opportunistic vectors. They take advantage. It's Thanksgiving. Woo-hoo! Let's munch down on some cells here. Let's make an infection. And that's what they see under a microscope, and that's what you get antibiotics for. Your immune system was weak, so they took advantage of that. And then what do? We take antibiotics to make our immune system what? Weak again. Right? Yeah. So imagine that. But cancer is no different than bacteria and viruses. So your immune system has to be weak enough that your body can't kill off the cancer cells at the normal rate. So when you have more cancer cells that kind of, escape that normal control mechanism from the brain, instead of making normal healthy cells more cancer cells are made, then things get out of control. But that's a process where your body is sick for a long period of time, and cancer's the effect, not the cause. Bacteria and viruses are not the cause of illnesses. They're opportunistic vectors. They're always there. Cancer is always there. It's always in your breast, it's always in your colon, it's always in your prostate. Cancer cells are always going to be inside of us. It's a normal process for your body to make cancer cells. Right or right? You guys know that, right? But it's not normal when your immune system can't kill them off. And when your immune system gets weak enough and cancer escapes that control mechanism, that's where we lose our ground there in that battle. So again, back to treatments. If your body is sick, the analogy would be a dirty fishbowl. If you don't change the water, if you don't keep the pH proper, if you don't take care of that fishbowl, what happens to the fish? They die. You know, basically you're polluting the water and the fish gets sick. So if your fishbowl is dirty, are you going to dump more toxins into that water to kill the fish? Or to save the fish? No, it's not the solution. So on a conceptual scale, again, I'm not, just stay with me now. Conceptually speaking, if the body's sick and you have cancer, if you're adding radiation or chemotherapy or something toxic to your body, does it help your body make new healthy cells by putting that into it? Okay, so as long as you understand that. Again, that's really what a lot of people miss. Like, my cancer was cured. I did the chemo, I did the radiation, my cancer's been cured. No, it doesn't work that way. Maybe they shrunk the tumor, right? Maybe they cut it out, but the cause of the condition, the internal ecosystem, did that change? No, that actually didn't get better. It got what? Worse, because you took a sick body that allowed that or caused that tumor or that cancer to grow, and now you just made the conditions that caused it in the first place infinitely worse. So you got to work double time. If you get something cut out or radiated, or you get chemotherapy, if you decide to do that, fine, but what do you darn well make sure that you do? Work on getting your body healthy. Because if you don't do that, you're at significantly greater risk for having another problem sooner than later. Is this making sense to everybody? Okay, so the cancer is the effect, not the cause. Everybody's got that, right? So what's the most sensible approach? What's the most sensible approach? Clean up the fish tank. Clean up the internal environment, the internal ecosystem. And like I said, you know, in some cases, if there has to be removal of a tumor surgically or whatever other method or means that you decide with your medical doctor to do, don't leave this out of the picture. That's the most important part. That's the only thing that will correct the cause, the source, and the root of why you had the problem in the first place. Your medical doctor will not discuss that with you. Your oncologist will not discuss that with you. You know why? Conceptually, they don't believe it. Conceptually, they don't preach it. Conceptually, they have no training on what to do to address it. The standard of medicine is very simple. My cousin is the chief oncologist in West Palm Beach. When my mom and I, we decided to go to Spain to another oncologist out there, and we went through the whole treatment protocol with my cousin here, chief of oncology at St. Mary's. He's like, yeah, it all makes sense to me. We just don't get that kind of training. That's just not what we do. So just understand that. You're gonna get whatever the standard of care here is, but that's not the only care that you can utilize to approach this. So this is the strategy that my mom and I took. My dad, they went over to Spain. Teresa and Joe just did the same thing. And you know, there are other avenues. If you truly believe what I'm talking about, and you actually go do the research to support what I'm talking about, you will find that all this adds up very, very quickly. There is not a cure for cancer. The only cure, it doesn't come outside, it comes from where? Inside. And whatever you decide to do conventionally is one thing, but you cannot overlook the most important part to make sure you stay out of doctor's offices, off of medication, out of hospitals, and you don't go through this ever again. Because it won't be the last time if this part is overlooked. Unfortunately, statistically speaking, that's what we're learning now. You're either going to treat the effect which is standard medical care here, conventionally speaking, or correct the what? Correct the cause. So, how do we change the internal environment, the ecosystem? We have to turn on the cancer-fighting genes. To turn on the cancer-fighting genes is in effect basically giving the DNA the proper environment so that we turn on the cancer-fighting genes and turn off the cancer-promoting genes. And here's where the rubber meets the road. Back in 1931, Otto Warburg won a Nobel Prize for, he discovered the respiration of cancer is different. The metabolism of cancer and tumors is different than normal cells. Cancer cells cannot survive in an alkaline environment. He discovered the normal pH of the body, which should be slightly what? Slightly alkaline? Yeah. And when the body becomes more acidic, that cancer has a field day. In low oxygenated environments, where there's fermentation, that's a perfect environment for cancer. So we know that regular cells use what for respiration? Oxygen, right? But not so with cancer cells. So that's what he won the Nobel Prize for. We talk about the alkaline environment. And you know, what we do as far as our levels of stress, what we drink, what we eat, can largely affect the pH on a day-to-day basis. Over weeks, months, years, you're either going to have an alkaline environment, slightly alkaline, which is normal, or it's going to be acidic. And depending on what your pH looks like, could strongly influence whether or not you're setting up a good environment for cancer to develop. So what does a good alkaline environment look like? If you look at the bloodstream up there, you see circles. What are they? Those are red blood cells. Yeah, that's a blood plasma field. That's healthy. You see it clear. The blood cells have a negative charge around them so that they negatively repel each other, right? The cells have a negative charge, so they repel each other, and they can go through the bloodstream a lot more quickly and carry more oxygen through there quickly. And if that's the case, your bloodstream looks like that. You can have low energy, Chris, or you can have good energy. You can have great energy, right? I just woke her up. That's what happens. Go ahead, fall asleep. Yeah. See what happens. That's good. I'm glad we can have fun, aren't you? Okay, so but think about your energy. You know, if you're not having good energy, this could be one of the reasons. And if your energy is really poor, if you look at the blood fields of a low oxygen environment, think of all the things that it's probably resulting from. You know, you look at all the fast food that we're eating, the processed meats, sugars, artificial sweeteners, coffee, cakes, donuts, alcohol. All those things are not man-made. You know, they're commercial, they're acidic, and what does it do to your blood pH? It brings it down. So basically, you know, when that happens, the blood inside ferments because of the acidic pH. And when the blood ferments, guess what? It breaks down the cell wall of each of those red blood cells, and now the integrity of the cell wall is disturbed, and the positive charges on the inside come out. And instead of it being negative on the outside, they become positively charged on the outside. And now they actually attract each other. They clump together. They stick together. How does that work? When you have red blood cells that are trying to carry oxygen through your bloodstream, and they're all clumped together, how's that? Is that a good recipe for energy? No. That's a recipe for fatigue, disease, cancer. So if you look at that, it's no wonder there are so many cases of cancer being diagnosed. That's the acidic diet and lifestyle. That's the standard American diet, right? And then you look at where we should be, many other cultures in the world, you know, water-rich fruits and vegetables, drinking lots of water, you know, with a good alkaline, slightly alkaline-based water, lemons, limes, avocados, tomatoes. You know, all the good foods made by God that hang from a vine or grow from the ground, you know, those are the things that really we should have the base and the majority of in our diet. But if we have, you know, everything that's processed, this is what we get, right? So we're either starving cancer or we're what? Feeding it. It's one or the other. So that was what he got a Nobel Prize for in 1931. So this has been around for a long, long time, guys. And he said that cancer only has one primary cause, and it's the replacement of respiration of oxygen in normal cells by the what? Fermentation of sugar. So what's a sure recipe to feed cancer? Sugar. That's why you get a PET scan when you go to the hospital, to find out where the cancer is. Wherever it is in your body, when they shoot that radioactive tracer in your body, what is it? Sugar. So that's what a PET scan shows, where the cancer is, because the cancer is going to town on the sugar, wherever you have it. One of the easiest and surefire ways, if your body's riddled with cancer, and if you really want to take control, the first thing that you have to do is eliminate what? Sugar. So we'll talk a little bit more about that in a moment, but just identifying where some of the problems are. All you have to do is read the labels, and it becomes more and more obvious how much sugar is in everything that we eat, and least of which is the middle picture, which is the hospital food that you get after your cancer treatment. All of it breaks down to sugar. Macaroni, pasta, bread, potatoes. And you know, if somebody's living on this, remember, this is breaking down to sugar. This is what's feeding the cancer. So, you know, it's not a good thing. And at some point, it's good for everybody to reconcile how much of this that we're having, not just cancer patients. But, you know, it also lurks, you know, beneath the surface when some of these things, you know, you got your eggs and your bacon and grits. Well, what's wrong with that? Well, I mean, grits. What are grits? Grits are made of what? Corn. So if you're eating this every day, or maybe on the off days you're having oatmeal, which is laced with, you know, brown sugar or maple syrup, and then you have the oatmeal that you rip out of a packet, which is filled with sugar without any of this extra stuff that we put in, then again, you're feeding cancer. Nutri-Grain bars, mostly sugar. What do we have with the Egg McMuffin? The bread. What do we have with this? The tortilla. More bread. What do we have here? Rice and beans. What do we have here? Most yogurts loaded with what? Sugar. Yeah. And we got fried chicken and potatoes. Well, again, you're making the potatoes with what? Milk. And then you've got the breading on the chicken. All sugar. We don't think about it, but I'm just trying to bring it to your attention. We got a steak, asparagus, baked potato, with cut potatoes. It may not be the worst thing, but you know what? Again, if you're a cancer patient, not a good idea. Yeah, rice, same thing. Noodles, same thing. So, am I saying that you should never eat this stuff? No, I'm not saying that. What I'm saying is that understand how the foods affect you. What's happening? When blood sugar goes up, feeding the cancer. You know, if your immune system's strong, you shouldn't have a problem with it. But if you're diabetic, or if you're overweight, you really need to start looking at this stuff. And if you're a cancer patient or you're coming out of treatment like that, I would go off of it altogether and look at something like a keto diet. So the other thing that you should be looking at is the bad fats, which drive inflammation, hydrogenated fats. And again, you know that they're going to be in the Dunkin' Donuts and the margarine and all the things that are fried, right? You know that, right? But where you wouldn't suspect it is if you go to, let's say, La Bamba, or your favorite Mexican restaurant, and you're anytime you're going to get grilled chicken or something on the grill anywhere, any place, are they using real butter? No. What are they using? Using margarine, or they're using Crisco, or they're using cottonseed oil, or soybean oil, or vegetable oil, and this all drives inflammation. So you have to be the master of your ship. You have to be the rudder to make sure that it sails straight, and understand how this affects you, because this isn't helping, it's hurting also. Are you still with me? All right. So as opposed to the bad fats, we can have good fats. What do the good fats do to inflammation? Make it worse or better? Better, yeah. So what's anti-inflammatory? Extra virgin olive oil. The omega-3 nutrition. Extra virgin olive oil, avocados, things like that. Make sure if you're going to do a stir fry, you're going to cook in olive oil, it should be what? Low heat, right? Avocados, avocado oil, coconut oil, raw nuts, seeds, oils like that. Almonds, walnuts. These are good fats that you really should have. And good fats don't make you fat; they help you lose fat. Real butter, grass-fed, or ghee, salmon, the fatty fish, sardines. These are all anti-inflammatory, and we should be putting more of this in our diet, right? We really should. If you're just having chicken and beef all the time, you really should take another look at this. because the more meat that you have in your diet, the more it brings estrogen up, and the more estrogen goes up, what does that do? Increases your risk of cancer. Yep. So we should take a better look at these things. So what's a ketogenic diet? It's a cancer-killing diet. What do you not see in this picture here? You don't see sugar. You don't see any carbohydrates. All you see is fat and meat. Fat and protein, basically. Fat and protein. Now again, I'm not going to recommend that you eat a lot of steak or red meat. I personally wouldn't do that. Dr. Helu, who we saw in Spain, that's not that, because it's acidic. So if you're going to look and try to approximate more of an alkaline diet and lifestyle, it's not going to be having a lot of red meat in there. So, but at any rate, I clicked out something fun from Dr. Oz. Just a real quick tidbit.
Decision. So, what is okay to eat? Green checks for keto.
Right. Okay. So, protein rich. These are clean proteins. So we got beef, pork, lamb, chicken, turkey.
So these meats have fats, obviously,
Right.
what you're looking for, but you can get your fat without having to, you don't have to escape to get the fat.
Absolutely not. So then we have nuts and seeds and oil. So we have macadamia nuts, one of my favorites, pecans, Brazil nuts, avocado oil, coconut oil, butter, ghee,
I don't understand.
full-fat yogurt, for instance, and even some of the, the fringe foods like unsweetened almond milk are okay.
I'm just going to go through a couple of these things. First of all, so there's lots of things you can eat that are actually arguably good for you, but there are things, this is what throws docs off.
Mm-hmm.
They're in the don't eat category. They're also good for you, right?
Right.
I mean, we all know not to have soft drinks, but what's the problem with an apple or a potato, for example?
Yeah, so apples, carrots, those are what we call high glycemic fruits and vegetables. So they convert to glucose pretty quickly in the bloodstream. And what we're trying to do here is we're trying to reduce the amount of glucose that gets into the bloodstream because glucose shuts off ketone.
Okay. So now you guys got the big picture with the sugars and how that all fits in. So I just wanted to cover that because that's part of the whole recipe for killing cancer. Best breakfast, low glycemic, the shakes, the Ultraplex Complete Clean or the Metaclear, we do that in the morning. Have some berries, low sugar fruits like berries, raspberries, blueberries, strawberries, with some almond butter. It's good healthy fats in there. For lunch, you see any carbs? Nope. Nope. And you got your, you may have a Caesar salad with salmon or chicken. Maybe you have a Greek salad. And what do you want to put on there? Extra virgin olive oil. Yep. So there you got your dinner. There's some lamb. Again, you want to mix that up. But what you're seeing is meat and vegetables. Same thing. Chicken, meat and vegetables. Stir fry, meat and vegetables. So we're getting the pattern here. Yeah. Even if you don't have cancer, that's not your concern right now. If you ate like this, what do you think would happen? You'd lose weight, feel great, and have your healthiest year and life ever. You would. And we know that because that's the general approach that we've taken with our weight loss program. People on our weight loss program, they'll lose 20, 30 pounds so fast it makes their head spin. And they wind up losing weight, reducing their blood pressure, their blood sugar medication, and that's what happens. This is it right here, guys. So these are the things that I wanted to cover with you tonight because it makes a difference as far as whether or not you get healthy or you make cancer. There's a supplement just for your awareness. Some of you guys may be looking for something like this to help your body get into ketosis. It's called Ultraplex Keto. It helps promote ketosis. And you can also use it for clarity or maybe fuel for your workout. It's a good product, but it fits in its application here. So I thought that was worth mentioning. All right, so I want to call my dynamic staff up front very briefly. Deborah, Tamara, Victoria, and please give them a big hand. We love them and appreciate them so much. Yes. All right. So, now that I got everybody blushing, there's a couple people I want to recognize for perfect adjustment attendance. One is here and one is not. So, Oh, both are here? Okay, it's just snuck in. All right, so this is for perfect adjustment attendance, and we just want to recognize a few people. Most of you guys are great with your adjustment attendance, but every once in a while, just want to love on some special people because we really appreciate that. Keep it on your schedule, doing your home care. What kind of results does that get you? Awesome. Do we get excited about great results? Yeah. So we want to reward that and encourage that. So this is for Elizabeth Johnson and Michelle Gordon. Stand up. Give them a round of applause. Give them a round of applause. Good job, guys. Awesome, awesome. Wear it proudly. Yeah. You guys are champions. And this is for 6 or more workshops. This is for our Elevation Health University Core 4 degree. So you've graduated, but hopefully not your last workshop, Joni Gunston. Whoa! Congratulations, 6 or more workshops. Not bad, not bad. Constant and never-ending improvement. All right, everybody stand up and turn to the person on your right. Put your hands on their shoulders and go ahead and squeeze, get all that stress out. We know the mind can only absorb what the seat can endure, right? Get that stress out. All right, karate chop. Oh. Isn't that good? Good job. All right, turn around and love your other neighbor. Get all that stress out. Good job. Awesome, awesome. All right, karate chop, karate chiropractic. Good. All right, give yourself a round of applause. Help me throw them. Here, come on up. Myra, help me through this. Come here, come here. Hey, heads up, here they come. Here they come. Go ahead. They're coming up. Woo! All right, winner, winner, chicken dinner. All right, hydration, is that important? Yes, so dehydration can, cause memory loss, can cause fuzzy thinking. Basic math is out the window. So, you can do a lot with your health by staying hydrated. It's a simple thing that eludes a lot of people. So, when you see me walking around with one of these bottles, I'll drink at least 3 of these a day, not including my shakes and other water that I drink during the day. I'm probably good for 4 to 5 liters of water a day. Good rule of thumb is half your body weight in fluid ounces. And a good test to know if you're hydrated or not is to look at your urine. If it's yellow, then you got some work to do. If it's clear, then you're in good shape. But this is one of the things that's going to help you stay more alkaline. If you're dehydrated, your body's going to start to move toward the acidic range. They have water that has a pH on the label sometimes. You go for 7.6, 8.0. I don't know that it's worth the extra money paying for the 10 and all that. I don't think it's going to make much difference. If it's just 7.5, 7.6, good enough. And you need a good pure source. And another way to help your body retain water or retain fluid without affecting your blood pressure is the pink salts. This is Himalayan and Hawaiian, from the Hawaiian volcanic ash salts, which are not denatured by high heat processing. So when you see the white table salt, which has all kinds of impurities laced in there, which causes your blood pressure going up, that's not this. This is different. This doesn't affect your blood pressure, but it will help the cells actually plump up from dehydrated raisins to well-watered cells. And it'll help you hold the water in your cells if you are trying to hydrate. And that's not just good for your health, it's good for your neck and your back too. Because what are the discs made of? Water and, cartilage and fluid, So if you're doing the wobble exercises, this goes a long way to help with that whole process. Just some food for thought. Is that a good one? Yeah. Okay, no extra charge. Epigenetics. So let's talk about exercise. Exercise important. Yeah. Somebody asked me the other day, should I focus more on losing weight and not exercise, or should I exercise and worry about the weight later? Well, I've known this for a long time, but studies show that people who exercise regularly and are slightly overweight live longer than people who are thinner and don't exercise, just so you know. And if there's one major factor that's missing from cancer patients and Alzheimer's patients, it's exercise. And studies are coming out now that are painting a black and white picture that they said, this was a 13-year study, 122,000 patients, Cleveland Clinic. They said being unfit on a treadmill or in an exercise stress test has a worse prognosis as far as death than being hypertensive, diabetic, or a current smoker. So smoking is bad, but sitting is like the new smoking. So if you're sedentary, if you're not exercising, if you have a desk job all day, your risk of death is higher than a smoker. Go figure that. So I've long been a proponent of doing a little bit of exercise every day. Some of you are exercising regularly, and that's great. I'm proud of you. I'm glad that you're doing that. Many of you are doing 3 times a week. That's kind of the standard that doctors like to tell you, do 3 or 4 times a week. You want to get a leg up and get ahead of most diseases, you do it every day. How often do you brush your teeth? Every day. How often do you put on your socks and underwear? Every day. How often do you take your medication? Every day. I don't know why exercise is any different. You know, cancer cannot survive in a well-oxygenated environment. Hello? How much more complicated do we need to make it? Get out, get yourself a good pair of shoes, and go for a brisk walk. You just need to do 20 minutes every day, 20, 30 minutes. Make it as regular as your devotional time, your prayer time, your TV time. You know, it's like, we've got time to do it. And the excuse that I don't have time, I have to get up early in the morning, really goes out the window, because we're just talking about 20 minutes, number one. Number two, you're going to have more energy. It's counterintuitive. If you think you're losing sleep and you're going to be more tired during the day, and you exercise, you're oxygenating, guys. That's high performance fuel right there. You're going to have more energy. You're going to have more peace. Your blood pressure is going to be more stable. Your blood sugar is going to be more level. And you're preventing sickness and disease, right? Okay. So let's take that to heart and put it in action. Cancer-causing toxins, when the cells become toxic, is that a recipe for cancer? We kind of know that, but I'm going to take it down a few levels for you here. The EPA says your indoor environment is 2.5 times more likely than your outdoor environment, 2 to 5 times more likely. So it's not the smog and stuff that we see outside that we need to be concerned about. It's what's inside. And what is that? Well, we talked about prescription drugs. Are they natural? Is it like eating a sweet potato or water? No, they're toxins, they're impurities, they're synthetic. And you guys have seen what it turns out to do. Irish Spring, your soap, your toothpaste, what does that have in it that we use every day? If you have not read the labels, there's something in it called sodium lauryl sulfate. Unless you're using Tom's or something that deliberately doesn't put these cancer-causing impurities in them, you're putting cancer-causing impurities in your mouth and on your body, on your skin every day, which it builds up. It's cumulative. It's not going to kill you in a day, but if you keep doing it every day over years, what happens? Your bucket starts to overflow. So the cells become burdened with that to the point where it turns on the cancer-causing, cancer-promoting genes, and it turns off the cancer-fighting genes. So this is something it should be looked at, right? What's in deodorant? Aluminum. How about that? What's in flu shots and childhood vaccination doses? Aluminum. And what else? Mercury. Yeah. Where does that go? Not just the cells, but your brain. And that's one of the causes for Alzheimer's disease. What else has mercury in it? The fillings, amalgam fillings, which most of us still have in our mouths. What else has mercury in it? The contact lens fluid, up until the late 90s. So if you used that for decades, up until recently, chances are you have a toxic burden from that also. What else has heavy metals? The water supply. Lead in our pipes? Yeah. It's interesting. I have relatives up in Michigan who have hypertension that they cannot get under control on 3 different blood pressure medications. And guess where they live? Very close to Flint. And what was just on the ABC News? Lead-resistant hypertension. And this is all coming to light in the medical community now, which is a real fact. Lead in lipsticks. Right? Most of the lipsticks that we use today, lead in paint, even though they don't have lead in paint anymore, still on a lot of the houses. The lead goes generations. Yeah?
What's the deal with contact lens solution?
They had, back up into the late 90s, they had mercury in the contact solutions. Yeah. Now they've taken it out since, but the problem is if we have that for so long, again, it's a burden that your body doesn't unload. It stays in there. You know, your body can do some detoxing, but if you look at all these things, if you look at all these things, then the question isn't, are you toxic? The question is, how toxic are you? And even though we may feel good, what is it doing at a cellular level? And when is our luck going to start running out? That's really the real question. You know, lead, it's not in the paint anymore, but what studies show is that lead gets stored in the bones, and it gets passed on in utero from mother to child. And so even if you didn't grow up in the lead generation like I didn't, right? My mother did, and it was passed on to me. When I had my blood tested, my lead and mercury were off the charts, guys. So this is real stuff. I mean, the tests are there. Many of you may not have been tested for it yet, but I can assure you it lurks beneath the surface, and it's in the cells. How about glyphosate? Everybody knows what GMO is, right? It's genetically modified. Corn, soy, all the crops, they genetically modify it to withstand the punishment from what? The glyphosate. The Roundup. How many of you guys know what Roundup is? It kills the weeds. Well, they genetically modify the crops so that they don't die. So the crops that we eat have this pesticide in it, the glyphosate, and the greatest application of glyphosate is in corn and wheat. And if you're eating products that don't specifically, if you're eating corn or soy that don't specifically say that they're non-GMO, then you're opening up the blood-brain barrier and allowing this to go to your brain. And they've shown the correlation with senile dementia and early death from that with the application of glyphosate over the last 20 years. So, you know, and simple studies where they've had laboratory animals and they injected glyphosate into the rats and the mice. Within a little period of 2 weeks, what came up? Tumors. So again, we're going back to toxicity as part of the recipe for cancer. This cannot be overlooked, can it? This cannot be overlooked. And this is what's going on in most of us at a deep cellular level. And God forbid we get a flu shot. You know, most of you are smart enough to know that you don't do that. But here are some studies just to know, like adults over the age of 50, the vaccine had a 24% effectiveness against all influenza and an abysmal 8% against the H1N1. That's the effectiveness of the vaccine. For acute respiratory illness, only 14% actually had the flu. The vast majority of cases of acute respiratory illness, coughing, sniffling, sneezing, aching, the fever, right, the chills, 86% of the time it was not the flu. And these are from CDC-controlled studies. And nobody's listening. Nobody knows. All you see is the advertisements for free flu shots. And now the marketing is so aggressive, they'll pay you to get a flu shot. They'll pay you to get a flu shot. That's how insane it's gone. So what's in a flu shot? Formaldehyde, it's with what causes cancer and leukemia, thimerosal and mercury linked to autoimmune diseases and inflammation, egg protein, sucrose and gelatin, polysorbate 80, aluminum salts linked to Alzheimer's. So again, we don't think, we follow blindly like sheep to the slaughter. And now this is, again, can we all see the reason why we have 5-6 times more cancer now than we did 40 years ago? We didn't see this 40 years ago. All the advertising, get online for a flu shot. I mean, come on. This is all big pharma. Okay, so this is what's happening at a cellular level. Embedded deep within the cell is your DNA, right? Are you all with me right now? This is important. So you got your DNA, and what do we say about the DNA? What's the key to preventing cancer? Turning on the cancer-fighting genes and turning off the cancer-promoting genes. Good. Now, when you're highly toxic with trans fats and all the toxins that we just talked about lurking in our environment, it hits the cell wall. And though the cell wall does not have receptors for these unnaturally occurring things in nature. There are no receptors. So they pummel the cell wall and they deform it in the form of something called inflammation because they can't get in. So it causes inflammation, and now the permeability of the cell is affected. So all your antioxidants, your vitamins, your minerals can't get in. The good stuff can't get in, and then the bad stuff can't get out. So through the process of cellular metabolism and respiration, your cells give off and they excrete wastes, right? It's kind of like if you ever build a fire. Did anybody ever see like a real wood burning fire? What's the effect of that? Smoke. You have a chimney. What would happen if you corked up the chimney? Kind of got the picture? Well, this is what happens when there's inflammation at a cellular level. So you can't get the bad stuff out, the cells become toxic, and then what happens is you start turning on the cancer-promoting genes and start turning off the cancer-fighting genes. And what you're doing also is you're shutting down a vital process inside the cell called methylation. How many of you guys have heard that methylation word? You know what methylation is? Methylation is a form of detoxification and cellular regeneration, which helps the DNA repair itself. What happens when methylation goes down? You start dying at a very fast rate. Yeah. Now, I've talked about cells that will help support methylation, but this is one of the things that's causing it. So the DNA testing is a key part of this process to uncover whether or not you're genetically in a good place to support methylation or you're at a weakness. Wouldn't you like to know, think about this, if you knew that your body had a moderate to high probability that you have a weakness in the area of methylation, would it make sense that that would be something to address if you were serious about preventing cancer? Yeah. Well, there's a test that exists that shows you exactly whether or not genetically you have a predisposition to that. These are the detoxification genes, CYP1A, GST. I won't go through all that. But in a gene testing report, we can identify the detoxification genomes, and we can tell you if you have a moderate or a high probability for your body's ability to get rid of toxins. These particular genes work with cruciferous and allium vegetables, garlic, onions, and help purge toxins from your skin and your sweat and your urine. If you're particularly weak in those genes, your body doesn't do very well at getting rid of it through those avenues. Are you with me so far? Okay. So if you saw in your report this is my report, by the way. So if that was your report and you saw that, what would it point to? Well, you need to support that. You need more water-soluble vegetables. You need more cruciferous vegetables. You need more antioxidants, maybe. You have something now to target specifically to prevent cancer from ever getting a hold of you. Does that make sense? So the gene impact is important because it tells you what you should or shouldn't be doing and where your body genetically is strong or it has a weakness. Remember we said it's not your genes that determine your destiny. It's what? It's the environment, right? It doesn't matter if you have these genes or not. What matters is if you do something about it. You're with me, right? Okay, so another one is methylation. These are the genes for methylation right here, CBS, COMT, MTHFR, right? And you saw my genetic impact. I have moderate, severely, impacted in some of these. And what this has to do is with actually repairing and regenerating the DNA. Is that a big deal? Yeah. So, when it comes to this, we have to support our body. Like in my case, I have to take a B vitamin supplement, B6, B12. These are all really important for methylation, for supporting methylation. So I have complete certainty and confidence that I'm addressing this right now. Down here, inflammation. What do we talk about? Shuts the cell down. Inflammation at the surface of the cell. Remember we talked about that? Just in the slide before? So you have genes. Watch this. When these genes, if you have a moderate to severe impact, the genes they're switched on. But if your body is working properly and you don't have this problem, you don't have this genetic tendency, the genes are switched off. In a normal working person, you have these inflammation health genes, IL-6 and TNF, that know how to shut off inflammation and fight inflammation in your body. But if you're like me and you've got a moderate impact in this, my body doesn't necessarily automatically do that well with shutting off inflammation. So I'm more prone to have inflammation. Systemic inflammation can be controlled with specific supplements like what? Curcumin? Hello? So we're talking about cancer prevention, right? So I know this, that's why I take a couple of these every day. And then the last one, so again, switching the genes off, the inflammatory response continues if you don't switch it off. And then the last one is oxidative stress health. Oxidative stress has to do with free radicals. How many of you guys have heard of free radicals in cancer? Your body has natural scavengers which clean up the free radicals. And you can take antioxidants like in the shake or supplements, but the vast majority of free radical cleanup is done by your body itself, if you have these genes working right. And it can damage the DNA significantly if it's not controlled. So again, we've had many patients do this already, and some of them have had cancer, some of them are going through cancer. And what's the most important thing that we look at with a cancer patient or anybody else? I just showed you just the cancer ones. But guess what? In that report, you're also looking at what causes heart disease, what you're predisposed to with diabetes. This is a 20-page report, so it covers really every aspect of your health. Now, $395, is it cheap? No, it's not cheap. But you know what? If you're a cancer survivor, or you're serious about preventing cancer, and you know how much it costs to go to Spain, $24,000, or go to Mexico for $20,000 for alternative treatment, or you want a shot every month that costs you $10,000 or $20,000, or chemotherapy, which costs tens, if not hundreds of thousands of dollars, then it takes very little time to realize that this is not a cost, it's an investment. Probably the greatest return on any investment that you'd be looking at when it comes to getting very specific information and very specific answers about what you can do to be proactive, not just with cancer, but with every avenue of your health. So is it valuable? Yes. Just like with some of the other supplements, we give you a discount tonight only for being here at the workshop. And if it's something that you're interested in, talk to Deborah and she can tell you how we do it. It's a kit. We do it right here in the office. It's a saliva cotton swab. And then again, it eliminates a lot of the guesswork. Now, some of you may be thinking, well, I'm not ready for that. And you know, what kind of supplements can I take to make application with this for that recipe that we're talking about causes cancer? Let's go into a couple of things generally speaking. This is more of a shotgun blast. The shakes I made mention of. In the morning when you take the shakes. If you don't have a multivitamin, the Complete Clean or the Mediclear has a multivitamin spectrum in it. It has antioxidants, it has your minerals, it has phase 2 liver detoxification. In other words, one of the things I circled here in the middle is N-acetylcysteine. Can you guys see that? That's the precursor for your body making glutathione. Glutathione is what your body needs for phase 2 liver detox. And so it's got a very gentle daily detox, a cleanse in there that'll help you with. And it's got some turmeric, a low level of anti-inflammatory like the curcumin, and it's got a significant protein source. Like the Mediclear has 22 grams of protein, and the Complete Clean has 26 grams, both of which I use after my workout. And you can use this very easily as a meal replacement, but at the same time, kill a lot of birds with one stone. I always talk about this at the workshop, and you'll save time and you'll save money because this is the breakfast of champions, really. And I wanted to bring that up. Some of the other supplements that you saw in your suite, sulforaphane is a significant antioxidant source, very effective, anti-inflammatory. This is the Ultraplex Onco, and it's going to be a significant support for detoxification. Curcumin, as we talked about, anti-inflammatory, just happens to have the most evidence-based literature as far as an anti-cancer support. It inhibits the proliferation of cancer cells. A lot of studies on this. Some of you guys have turmeric at home that you like to sprinkle in your food. Not the same as this, sorry. You know, you need mega doses. You know, what you're doing is not a bad thing. It's not a bad idea. But we're talking about mega doses, guys. If you want to get a therapeutic effect, if you want to calm the inflammation at a cellular level, and you really want to see some, like a clinical outcome, you need to take a couple of these every day. I take 2 of these every day. Again, if your DNA testing report shows otherwise, you may want to take more. But again, that's the whole purpose of the testing, so you know what to do and what not to do, where to invest your resources. If you're going to take supplements, you know, you don't want it to be expensive urine that you're just going to pass through. You take what you need, and you don't take what you don't. And the way to eliminate that is with the testing. Everybody's different, right or right? Right. Everybody's different. But this is, listen, this is not a bad thing. With the curcumin, you know, it's good for your heart, it's good for cancer preventative, inflammation. So I take 2 of them also. CoQ10, at a cellular level, this is a necessary molecule for making new healthy cells, especially if you're on cholesterol medication. If you have heart problems, you should be taking one of these. But as far as cancer preventative, again, as far as a recipe for making new healthy cells, studies show that CoQ10 is foundational for that. So this is not something you want to overlook. Vitamin D. How many of you guys have long known how important vitamin D is to prevent rickets and scurvy? Right, so everybody knows that from the 1940s, 50s, take 400 international units. Meanwhile, they're finding today that if we only would have taken 5 or 10,000 units, we could have prevented most of the cases of cancer that we see today. Your body makes vitamin D if you're out in the sun, but how many of you guys sunbathe every day? No, come on, you live in Florida, what's the matter with you? Listen, vitamin D, everybody should be taking a minimum of 5,000 international units. We do testing here in the office for that. If your doctor hasn't done it or you want to get tested, let us know. But at a very minimum, you should be taking 5,000 international units. If you're undergoing cancer therapy or you're recovering from cancer, you should be taking anywhere between 10 and 20,000 international units. Don't underestimate how important this is for cancer prevention. So that's our supplement suite. You know, you get a discount when you get everything together. There's, you know, we have limited resources tonight, so if you want at the end of the program tonight. If you want to get a 25% discount on anything else, give us a 5-star review. We'll give you a little gift certificate. I want to thank those of you who have done that, because when people read reviews, you know, it really helps them and it makes a difference in their lives. Update on my mom. A lot of you, you know, so kindly asked how my mom was doing. Her markers are still going down. She went for a PET scan last month. This is 2 years after. She had 3 lesions in her liver. Now she only has 2, and the 2 that are left have reduced in size also. Did she stop doing what, you know, we talked about tonight, or what she learned in Spain? No, she still, you know, mostly follows a ketogenic diet, alkalizing nutrition, anti-inflammatory nutrition. She keeps up with her supplemental regimen, oxygenation. She said she does some kind of exercise every single day. She detoxes. She takes supplements for that, and she gets adjusted every single week. I have a friend down in Miami who takes care of her. And when she was in Spain with Dr. Helu, he does a different type of nerve system stimulation. He does it through the optic nerve. But his approach, his tool is different, but the principle is the same. That the nervous system is really what's at the core of making new healthy cells, right? So that's what I want to finish up on. Don't go anywhere yet. Give me 3 minutes, because this is the most important part. You could eat good and exercise. You could take all the supplements till the cows come home. But if you've got nerve interference and your cells lose communication with the control mechanism at a brain level, you're not going to make new healthy cells. You're going to still make cancer cells. And there was a study done back in 1975, New York University Cancer Research Center. They studied the immune systems of cancer patients, non-cancer patients, and non-cancer patients under chiropractic care. It was a 5-year study. How many years? 5 years. What do you think they found at the end of the study? The chiropractic patients had immune systems that were how much? 300% stronger. That's why I told you at the beginning of the program tonight, you're different. If you're under chiropractic care, you don't run with your tail tucked for the hills like everybody else does, quaking in fear. You've got something else going on that gives you a significant gap from the average person in the population. Your immune system is significantly stronger. The likelihood of you having a cancer diagnosis or a poor prognosis, if you ever do, and anything happening from there, is little to none. And I know that because I haven't lost too many patients to cancer who have been under my care. I have had some patients be diagnosed with cancer, but again, we know that's par for the course in many cases. But how many have I actually lost that died under my care? I could count probably on my left hand, maybe 5 or 6. And I can tell you, with every case that I've lost to cancer, it wasn't the cancer that killed them. What do you think it was? It was the chemotherapy. Yeah. So one of the guys that I never forgot and I never will forget was Peter Matloff. And if you ever go in the restroom there and you see the picture of the clown getting adjusted, he says he's subluxated with his funny bone. He's a sad clown. You'll check that out. Peter gave that to me. And he was referred in by somebody and he had neck or back pain. I was taking care of him for a while. His neck and back pain went away, but Then it came back and it wouldn't go away. And then he finally went to the doctor and they told him he had stage 4 cancer that metastasized from his lungs all the way until through his skeletal system and his spine. And that's why his back was hurting so much. So he said to me, listen, he's like, I know you helped me and I know what you believe in and I'm not sure what I'm going to do, but what would you recommend that I do in this case? Should I stop? Should I continue? I'm like, listen, you've been to so many workshops. You know how the nerve system is stimulated and significantly stronger when you're under chiropractic care, right? He's like, yes. So what would you do if you were in my position? I said, I'd be getting adjusted every day or 3 times a week. If you were my dad, I'd be adjusting you 3 times a week. Because at that point, he was coming like every other week. I wasn't seeing him a lot. He was on maintenance. So he started coming in 3 times a week all over again. But he decided to do the chemotherapy. And every time he did the chemo, oh man, not only did his hair fall out, he looked like 10 years older. And then the effects of the chemo would go away. He kept coming 3 times a week, years, 2, 3 years, 4 years went by, did another round of chemotherapy. And the same thing happened. He aged another 10 years and his lungs filled with fluid, hard time, I'd adjust them. And then another few years went by. So now this is 6 or 7 years that have gone by. And now it comes back again. So what did he do? Another round of chemo. This time it was so bad that he couldn't leave his house. And so this was, year number 7. I was adjusting him over here in Jacaranda. I went to his house. And, all he told me was that, I just don't want to let my grandson down, Michael. I want to stay alive long enough to be at his bar mitzvah. His bar mitzvah is going to be in another 2 months. That's all I want. I just want to live long enough to see his bar mitzvah. I promised him I'd do that. And I'm like, what does your oncologist say? He's like, he's never had a stage 4 cancer patient like me, when I was diagnosed 7 years ago, make it this long. He's like, I'm a laboratory experiment for him. He's like, but he said to me, he's like, I know if it wasn't for the chiropractic care, I wouldn't have made it this far. And I said, that's a fact, for sure. That's a fact. It definitely extended his life. Did it cure his cancer? No. But what ended his life ultimately early was the what? Not the cancer, but the chemo. So did he make it to see his grandson? Yes, he did. He made it. And chiropractic added years to his life and life to his years. And I'll be the first to tell you, I don't have a cure for cancer. I don't have a cure for migraines. I don't have a cure for back pain. The cure never comes from my hands or from the outside in, right? Where does the cure come from? From the inside out. And if you apply everything that I'm talking about, basically it's about removing interference to what your body already knows how to do. Can your body heal a broken bone? Yes or yes? Can it heal a cut on your skin? Yeah. Did it go to school or college to learn how to do that? No, it's innate. It's an inborn wisdom. So it knows how to kill off cancer cells. It doesn't need any help. It just needs no interference. Where can there be interference? Neurologically. And medical schools already teach this. If you take the nerves away from the spleen and the lymph nodes, you stop the immune system in its tracks. But what happens if you interfere with the nerves going to the brainstem or in the middle where they go, in the mid-spine where they go to the spleen? You're going to shut down nerve supply to parts of your nervous system that control these parts, and they're going to get weaker. And your body won't be able to kill off cancer the way it should. So when we make adjustments to these areas, I can look you in the eye and I can tell you, you're going to get better. Now your symptoms may not go away, but from removing the interference and reconnecting the brain with the tissue cell, you're going to be better off without that interference. And as time goes on, you make more healthy cells and less bad cells. Does that make sense?
Yeah.
There was a study that was done in 1990 when I was in chiropractic school with patients that had AIDS. And it only involved this top level at the brainstem, because there's a part of the nerve system that overrides everything in terms of your immune system, right at that level. And they took 2 groups of patients. One of them got real chiropractic adjustments. The other group got fake chiropractic adjustments. And they only adjusted them right here. And these were all patients that had HIV. And the patients that got the fake chiropractic adjustments, what do you think happened to their white blood cell count? Nothing. Patients that got the real chiropractic adjustments, just right here at this level, what happened to their white blood cell count? Went up 48%. CD4 is the primary component of the white blood cell count that's compromised in AIDS patients. And all they did was adjust them right here. And what did it do to their immune system? Boosted it every single time. I graduated in 1993. I took that study with me to an AIDS shelter in East Fort Lauderdale. And what happened? Same exact thing. I volunteered my time. I got the blood reports back from these patients. Many of them were able to reduce and get off their AIDS medications, and it made a big difference. Can it make a difference for you? So the next time you get a cough, sniffle, sneeze, flu, or a cancer diagnosis, where are you going to be looking for help? From the outside in or from the inside out? Again, so it doesn't matter what the effect is, what the symptom is. You're always better off without nerve interference. You're always better off getting adjusted. When in doubt, get adjusted. My kid came home from swimming in Orlando. They were all in Disney World, all these swim parks for 4 days. His ear was hurting last night. What did my wife ask me to do? Adjust him. That's what I did. So I adjusted him. He woke up this morning, had a little ear pain when he woke up, and I came home for lunch. He was fine. He was playing on the computer. We kept him home from school just to be sure. He was fine. It's all we've ever done with our kids. When in doubt, get adjusted. It helps prevent problems, and it'll help to save you from running around like a chicken without a head, taking all these drugs and going to all these doctors and getting tests and getting into more trouble. Now, like I said, there's a time and a place for all that, but you can stave it off for a long time if you do these things properly. What do you get checked for? Subluxation. What is a subluxation? It's a misalignment where the bones go out of alignment, and it puts pressure on the nerves. And if those nerves are feeding off to your spleen or to your lymph nodes or to any immune system organs, what is that doing to your risk of cancer? Increasing. Would you know if you had subluxation? Would you know if you had a pinched nerve? No. It's the biggest misnomer, misunderstanding, miscommunication. Studies show that you can have the weight of a dime on a nerve and be losing 60% of that nerve supply. You have no idea. Your organs could be shutting down. You have no idea. No different than a cavity or cancer. You don't feel that in the beginning stages. When your body gets weak enough or bad enough, that's when you find it. When should that be detected? Before or after you have a problem? Before. That's why when we talk about correcting your spine, is this a temporary thing? No. So for those of you guys who are under chiropractic care, what's the most important about getting care here? Fixing this or keeping it that way? Yeah. So how long are you going to keep having your spine checked for? For how long? For the rest of your life. If you're serious about preventing problems, preventing health problems, you can't take a drug to fix that, can you? No. You can't take a supplement to fix that. Matter of fact, if you had one choice to buy the supplement suite tonight or to get your spine checked, I'd say don't waste your money. If you're not under chiropractic care, I don't want your money. I want you to know the truth. The most important thing is that you've got proper nerve supply in your body, because nothing else matters if you don't have that. And if you're a guest here tonight, I got to tell you that if you don't have a chiropractor or you haven't had your spine checked in a really long time, don't consider doing anything else that I've talked about tonight until you do this. Now, if you have your spine checked and you do all those other things, you're a pretty good student, and you've got a pretty good proactive plan for staying out of problems and out of trouble. But if you don't know what to do, as far as looking for interference neurologically, you start with a consultation where I sit down with you and I find out a little bit about you, and then we move into an examination. We check your posture, we do a thermal scan, that's NASA space technology, which allows us to find where some problems are. And if those problems warrant the need for x-rays, then we take x-rays. And we put everything together, and at that point we tell you what we can or what we can't do. I never promise something that I can't deliver on. You guys know that, right? I'm all about testing, eliminating the guesswork, and having an evidence-based picture for everybody to make an intelligent decision from. Now that testing that I'm talking about, normally that's upwards of $300, but if you're a guest here tonight and you'd like to take advantage of that and you're serious about your health, I'm serious about helping you. Do not hesitate. Go over to Deborah and ask her about having an appointment to have this done. For $47, we will do several $100s worth of testing to evaluate the health of your nervous system. And that'll give you detailed information about your health in terms of which way things are going, for better or worse. And if you're serious about doing something about it and being proactive, this is the place to start. Not the supplements. If you want to get supplements, be my guest. But like I said, you're throwing money out the window if you're subluxated. So look at that, and then also take heart in knowing that 100% of that $47 is going to our Mission to Haiti. We still support Mission to Haiti at our church, clothe, feed, and educate the kids. We rebuilt a lot in that village where there was damage from the earthquake, and we continue to support them. 100% of that $47 goes to them. All right, so if you're serious about that, please see Deborah, and she'll talk to you about that. That offer's only good for tonight, so please see her about the schedule. So now it's time to make application, guys. Make sure you get scheduled for next month's workshop. You know, if you need supplements, see them at the front desk. And guests, you know where to go for Deborah. She also has the information on the DNA testing if that's something that you'd like also. Thank you so much for coming, guys. You've been a wonderful group tonight. I love and appreciate you. God bless.